at least part of what I was thinking about in the inception of Respect Mental Health is the telehealth component, the telehealth format to target people who currently are homebound, meaning it's unsafe to go out to visits. You know, obviously there have been a lot of startups in this regard so that you could have a therapy appointment from your watch or from your phone, and those are great. But for the elder population, that may not always be the best option. People are not always as technologically astute as the younger population. They may not have anybody necessarily present to help them in that regard. I wanted to make it a very easy format to do a telehealth with an elder, and develop a website that allowed them to navigate the process very comfortably, to have an assistant associated with Respect that can give them further help on a one-on-one basis and allow them to feel comfortable with the format. Certainly there weren't Zoom calls and all of that when I was first practicing as a critical care nurse, so I get it. The other thing is it allows caregivers to have a lifeline, support. If you're ready to have a meltdown in the corner of a bedroom somewhere, or you just are at the end of your rope, you know, you can sit down and make a call, and therefore, you know, maybe avert a disastrous type situation for yourself. And I think that's important, knowing that there'll be somebody there to just talk to, you know. It's very powerful, I feel like. When my mother was very ill and I was staying with her, I started to feel isolated, very isolated myself, because, you know, she couldn't manage going and staying, and I had very little respite before we hired an individual. But I know that at that time, if a mental health visit had been possible, I certainly would have utilized it, certainly.